guys, the first topic I'm going to talk about is depression, because it's so common, but it's not getting the attention that it deserves. Maybe a little bit more in the last year because of COVID and everyone's isolated and not feeling well about it, but generally it's not a topic we hear a whole lot about. Unlike post-traumatic stress disorder, for instance, our military veterans have sadly been committing suicide at unprecedented rates, and our state governments and federal government have responded by trying to access mental health care for them, and it's helped some. Also, again, prior to COVID, you remember hearing all about the opiate epidemic, which was causing our morgues to bust at the seam with people accidentally overdosing on fentanyl and heroin, and the media responded by legitimizing it as a proper mental health diagnosis, and again, state governments and the federal government responded by accessing treatment options for people. But what about depression? It's not killing people at a different rate than it has in the past necessarily, but it still has a huge cumulative impact on our life and our health. So, what causes it? What are the symptoms? And how is it treated? Well, first of all, there is a genetic component to it. Some people are more likely to be depressed than others. There's no blood test that you can go to your doctor's office and take, the way there is for other medical illnesses, to determine whether you're more likely to become depressed at some point in your life or not. Really, the best way to determine that is if you have a close family member who's been depressed or had some other kind of mental illness or committed suicide, for instance. Then genetically you're more likely to become depressed. However, environmental stressors also have an enormous impact on people's mental health. So if you're genetically more likely to become depressed, it doesn't necessarily mean that you will, and if you're not genetically likely to, it doesn't mean that you won't. Stressors like financial stress, problems at home, problems at work, other health problems can all affect a person's mental health and cause depression. You know, the brain might seem like some complicated and mysterious organ, which in some ways it is, but in some ways it's not, and it's helpful just to look at it like any other organ in your body. Take a bone, for instance, something pretty simple. If you had two guys who were genetically similar, but one guy takes care of himself, he eats right, he exercises regularly, he doesn't smoke, and doesn't abuse alcohol, then it's obvious that he's going to have a higher bone density than the same genetically similar guy who doesn't take care of himself by eating improperly, not getting enough sleep, smoking a pack of cigarettes a day, and drinking a six-pack of beer a night. Throw in a third guy to the mix, someone who takes as good a care of himself as the first guy, but just genetically has bad luck and has a lower bone density. If you apply a physical stress to each of these three guys' bones, at some point they're going to break. Just the first guy's bone is going to break last because he's got a higher bone density. It's the same thing with the brain. People have different genetic predispositions to mental health issues, and how you take care of yourself is also going to have a big impact. But if you apply enough stress over time, people do have a breaking point. I experienced this myself about 10 years ago when I was a second-year medical student at the University of Miami. See, the first 2 years of medical school are a real academic grind, where you're force-fed 5 to 6 hours of brand new scientific and medical information every single day and tested on it every 2 to 4 weeks. I was doing fine, always in the middle of the pack academically, but I did always need the full allotted amount of time to finish my exams, which averaged out to about 2.5 minutes per question. Well, at the end of your second year of medical school, every student in the country needs to take the first in a series of 3 United States medical licensing exams. This is a standardized test, which again, everyone has to take, and if you don't pass it, you can't move on to your third year of medical school, and even if you do poorly on it, it has a big impact on your future career prospects as a physician. Now, I wasn't so much nervous about the content of this exam, I was worried about the time, because it's an 8-hour exam and you only get 1.5 minutes per question. Well, this started to drive me crazy. I became convinced that there was no way I was going to pass this test, that I wasn't going to be allowed to move on to my third year of school. I'd have to drop out, now with about $100,000 in medical school debt at that point, and no way to pay it back, and no medical degree. A few weeks later, after feeling this way, I started noticing some other things. I couldn't sleep at all. I'd go to sleep each night without any problem, but every night around 2 or 3 o'clock in the morning, I'd wake up in an absolute panic, with my eyes wide open, my heart racing, my mind racing, sweating, and there was just no way I was getting back to sleep. I also had no appetite. I couldn't eat anything, and had to force feed myself at least a little bit once a day just to get in some nutrition. I also couldn't concentrate on anything. I was spending even more time in the library because I had all this extra time from not sleeping, so I'd just go to school and try to study. But I wasn't absorbing anything. I wasn't able to pay attention to anything. So actually, my grades in my courses at the time started to suffer. This went on for a few weeks, and then something else happened. I became convinced that I was growing a mass, or some kind of tumor, in my abdomen, right in the exact spot where a horse had bit me when I was a kid. I started to think that this injury that I had many years ago had somehow been reactivated and I was growing a cancer in my stomach. It was this that finally brought me in to see my doctor. So can you imagine what my doctor must have thought when he had the second-year medical student come into his office and said, "Hey doc, when I was 10 years old, a horse bit me on my stomach and it somehow reactivated and it's growing into a cancer." Well, he humored me and did a proper physical exam, but he then asked me, "So Mark, what else is going on?" I said, "Well, as you know, I'm in my second year of medical school. I'm studying for the USMLE Step 1. I can't sleep, I can't eat, I can't concentrate, and I'm just generally feeling completely miserable." He said, "All right, well, I'm going to send you downstairs for an abdominal ultrasound, but I also want you to start taking an antidepressant." I agreed. I went down for the ultrasound, which, of course, was completely negative, no tumor, but I did start taking that medicine. After a few days, I didn't notice much of a difference, but after about a week, oh my gosh, the difference was incredible. I remember the first morning, the relief I experienced when I woke up at 7 a.m. calm rather than at 3 a.m. in a complete panic. I got my appetite back, I was able to concentrate, my grades started going back up, and as you can imagine, the mass in my stomach slowly disappeared. So how many of you guys out there have experienced something similar, where you had some stress or multiple stressors in your life, causing you to feel just a little bit different than you normally do? If you recognized any of what I just said, then you looked in a textbook, you'd see that actually what I just described is essentially the definition of a major depressive episode. It affects your sleep, it affects your appetite, it affects your concentration, your weight, your sex drive, your interest in doing things that you normally like to do. And if left untreated, it can progress into delusions, and even worse, thoughts of wanting to hurt yourself. If you ignore the symptoms and just go untreated, it's possible you'll start to feel better over time, perhaps as whatever's causing the stress goes away at some point, but it'll take more time and a lot of undue suffering, which will have an impact on your mental health and likely your physical health from the increased stress. You also might develop some unhealthy ways to manage what you're feeling, like substance abuse, denial, or just isolating yourself from anyone. Or you can recognize that something is going on. You've probably heard it from your family or your friends who tell you you don't quite seem yourself. Something's not quite right. Maybe it's best you get some help. It's hard to have this objective analysis on yourself, but if you can and you access proper care, you can get yourself feeling better. So what do I mean by treatment? It doesn't mean that you need to lie on a couch for an hour each week talking to some guy in a bow tie about your relationship with your mother. But the first step is just recognizing that something is wrong and accessing the proper care. Going to see your primary care doctor can be a solution because most of them actually are comfortable prescribing an antidepressant medication. If it works for you, then great, you'll feel better. But if it doesn't, and you want to try a new one, it's probably better that you establish care with a psychiatrist who specializes in using those medicines to treat the specific symptoms that you're experiencing. Of course, there's also always room for talk therapy, and I do recommend it for most people. Not everyone, but it does take a little bit longer to get you feeling better than medication can. Most importantly, when you do decide to access care, don't convince yourself that you're weak or that you're a failure for doing so. If you were in a car accident and you broke a limb, you wouldn't consider yourself weak or a failure for going to the hospital and getting it fixed. So if there's an environmental stressor that's causing your brain to be a little bit out of balance, don't beat yourself up over it. Go to the doctor, get it treated, feel better, and move on.